as global cases have settled and attention turns to the next steps in the pandemic. After Omicron caused pediatric cases to jump, Pfizer and BioNTech said they have begun submitting data to U.S. regulators for authorization of their shot for children 6 months to 4 years old. This, as a New York State court is challenging the state's requirement that masks be worn in schools and businesses that don't screen for vaccination. So here with us always on Wednesday is Dr. Amish Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, thanks so much for being here. So as we mentioned, Pfizer and BioNTech have begun rolling submissions for authorization of this vaccine for young children under 4. Can you talk to us about this process and how soon parents will be taking their children to get vaccinated?
When it comes to this age group of children, it's a little bit difficult because we've already seen some data that, especially in the older version, the older portion of that group, children aged between 2 and 4, the 2-dose regimen that they're using with the lower dose doesn't seem to be that immunogenic. So those individuals are likely to need a third dose. 6 months to 2 years, it does seem that this looks good. So what you may see is the FDA say the 2-dose regimen works for 6 months to 2-year-olds. That will get emergency use authorization fairly quickly. And then for the 2 to 4, they may do some type of provisional, highly kind of irregular approval and say those 2 to 4s will get 2 doses, and then we'll continue to study this on a rolling basis and decide whether a third dose is necessary for full protection. So this is going to be very confusing, and I think it's going to be very difficult in the world of all the vaccine hesitancy that we have to be able to explain to people why a 2-dose regimen is getting approved when it's likely going to be 3 doses for that other age group. So it's going to be a lot of confusion, but that's kind of par for the course when it comes to the way these vaccine decisions are being made by the FDA and ACIP.
Well, and I read some stats somewhere that said the request came a little bit faster than some people were expecting. I mean, for a parent who's trying to parse through all of this information, you called it confusing. How do you explain it? I mean, should any of this give parents pause, or what are the questions that they should be asking their doctors then?
There is no safety signal that we're seeing in this age group. It's just what's the optimal dosing, especially in the 2 to 4 age group, and that needs to be worked out. So when you look at children, for example, we have people between 5 to 11 that are eligible for vaccination. The vaccine uptake rates there are very low. I suspect that they're going to be even lower in this group because we've not really done well at vaccinating children. There was a lot of vaccine hesitancy amongst parents that's really not budged so much. So this is going to be something that each parent is going to have to decide for themselves, but I suspect you're going to see even a lower uptake. And I think that this could have been avoided if you would have done this on a normal process, because in the middle of a pandemic, when we're also dealing with a pandemic of misinformation and vaccine hesitancy, people want confidence that the process is working as it should. But what we've seen with vaccines is, for example, is the FDA failing to convene some of their committees that are really important, like VRBAC. We've seen the CDC director override ACIP. These types of irregularities only sort of add to this mystery and conspiracy theory mindset that we have. And I just worry that this is going to happen again in the pediatric age group, and they should be doing this sort of by the book, because I don't think even though there's a lot of demand for this vaccine for that age group, there's no urgency to it. We can still work on getting other people vaccinated to protect that under age 5 group.
But Dr. Adalja, still, I mean, you mentioned vaccinations between 5 to 11, and as you mentioned, the vaccination rates have been lower than what we've seen in older people. But as you also mentioned, there's been new concern about Omicron and sort of its spread, and especially among younger kids. I feel like I'm hearing more and more younger kids who are potentially getting the virus. So should parents then get this vaccination for their children?
I do think it's a safe and effective vaccine. I think it's going to be a little bit difficult with the 2 to 4 age group because of the dosing that we have to still figure out. But it's important to remember that kids are going to get infected with COVID-19. When cases go up, kids are going to get infected. And if you're unvaccinated, you're going to be more likely to get infected. So it's not surprising that children's cases went up during the Omicron surge. The virus isn't targeting children. It's targeting unvaccinated people. And most people are back, especially children, because they're at low risk for severe disease, are back to their normal activity. So they're going to get infected. I think it'll be important to have a vaccine to protect them. But I just worry about how this is going to play out in the world, in the context that we currently have, where there is so much misinformation and lies spread about this vaccine that we may not see an optimal uptake. Probably a lower uptake than in the 5 to 11 age group, which is already low, and then we already have a low uptake in children that are 12 to 17. That's also low. And I think we really have to come back to our public health communication and increase confidence in vaccines, because this is going to be something we deal with for even other childhood vaccinations if we don't stop this vaccine hesitancy.
Right. And we mentioned this in the intro, Dr. Adalja. This also plays into this conversation about young kids, but a lot of parents wondering whether or not to mask their kids anymore. I mean, where do you stand on this? Is it vaccination or mask? Is it both? I mean, especially for young kids.
All of this depends really on individual risk tolerance and risk factors for severe disease. Clearly, if you have a child that has asthma or had an organ transplant, they should be very careful when there are high levels of cases and they're in high risk situations. But I think for others, the risk of severe disease is low. Schools have other mitigation measures that they can put into place. And I think that we have to think about off ramps for schools to decrease some of the mitigation and start treating COVID-19 like other respiratory viruses that they deal with year in and year out. That's where we're increasingly going. Having everybody vaccinated makes it much easier to do so, but it's not always the case that you have to have that high level of vaccination if you've got cases down and you've got other mitigation and you've got some understanding that you're not going to be able to prevent every case. We're going to have COVID cases in schools 10 years from now. That's an inevitability. So we have to come up with a sustainable approach. I think if the situation is that it's masks or distance learning, masks are better than having children go virtual. So if your school district is one that's going to go to virtual, if they get a certain number of cases very quickly, that's something that they have to think about. But if it's a school that has a sustainable approach to dealing with cases using the CDC's test to stay methodology, then I think you can think about removing masks, especially in the pedagogical part where you're sitting in classrooms. That's not so much where transmission occurs. Transmission occurs with extracurricular activities, or in the cafeteria, or when people are going to clandestine dances or whatever it might be.
And when we talk about the community more broadly, I also want to read a quote that we got from the WHO's chief yesterday, just talking about still sort of where we're at in this pandemic. He said, "We're concerned that a narrative has taken hold in some countries that because of vaccines and because of Omicron's high transmissibility and lower severity, preventing transmission is no longer possible and no longer necessary." Nothing could be further from the truth. He said that sort of in response to a lot of countries globally easing restrictions. When we talk about the wider community and people who are vaccinated, where do you think we should be at right now? Of course, it depends on where you're talking about, but is easing restrictions okay at this point in time? Are we sort of at that point?
I do think so. If you've got vaccines widely available to your population, then I think you're really starting to decouple cases from hospitalizations and deaths. Yes, you can stop transmission, but do we stop transmission for many other respiratory viruses? And for the vaccinated individuals, that's what COVID-19 has become, something very similar to the other respiratory viruses we deal with year in and year out. And this is not a virus that's going to disappear. It's not going to magically go back into bats. We're going to have transmission. Yes, you can take steps to decrease transmission, especially in high-risk situations, but I think we're at the point where we have to transition to something that's sustainable, that reflects the fact that there's going to be a baseline number of cases, just like there's a baseline number of cases of influenza. And we can use targeted methods when we need to use them. But that idea that we're going to continue to use blanket solutions for something where we have targeted therapies like antivirals and monoclonal antibodies and rapid tests, as well as the vaccines, and so much knowledge about what types of activities are high risk and low risk, that doesn't make sense in 2022.
All right, Dr. Amish Adalja, we have to leave it there. Senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Thanks so much, Dr. Adalja, for your time. And we should note the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.